Good morning, everyone. I'd like to welcome the graduates of 2016. Woo! Their friends, their family, fellow faculty, and American International College administration to our annual pinning ceremony. This morning is the beginning of the next leg of your journey in your career as nurses. It's an exciting day, and you should feel a sense of pride for all of your accomplishments, for you have all worked really, really hard to get to this point in your life. Each of you has sacrificed and faced challenges and persevered. Now let's begin our celebration. And I bring to the stage Dr. Raj Parikh, our Executive Vice President of Academic Affairs at AIC.
Thank you so much. Good morning. I bring you greetings from President Maniaci, who couldn't be here today, and on behalf of all the faculty and staff and administration at American International College. It's wonderful for us to see so many people graduate to reach their academic goals. And also, I want to congratulate the faculty for all the mentoring and guiding that they have done in the past. I wish you all great success and have a wonderful day. Thank you.
And now I'd like to present Dr. Chesarina Thompson, the Dean of the School of Health Sciences.
Good morning, everyone, and welcome to AIC again in our pinning ceremony for the 2016 graduates. This is actually the fourth celebration that we've had for our health sciences graduates this weekend. As Dean of the School of Health Sciences, yesterday I had the pleasure of attending celebrations for the public health graduates, for OT, and for physical therapy. The pinning ceremony, however, it really originated in nursing, and other health professions have adopted that. And it's really a special way for us to recognize your transition into the professional world. And as a nurse myself, it has a special place in my memories, not too long ago, I'll say, when I was sitting in your seats. And so it just gave me the chills even watching you come down the stage again. And although lots have changed since I graduated in healthcare and in nursing, nursing still remains the backbone of our healthcare system. All of the other health professions certainly work with us as we care for patients, but it's really nurses, as you know, and as you've learned, that really hold everything together. And I'm very proud that here at AIC, we really prepare the very best nurses. So congratulations, and I look forward to hearing about all your great accomplishments.
So I just would like to take a moment to introduce the faculty that are here present. If you just stand in your seats when I call your name and hold your applause till we're done, because I know you all want to do a cheering section as far as the students. So we'll start with Susan Turnbull, who's our administrative assistant and all-around go-to for the students. Professor Rose McKinnon, who does medical, surgical, and leadership and a little bit of everything else. Professor Lynette Wilson, who's community health, fundamentals. Professor Dina Dittmar, pediatrics, fundamentals, and a whole bunch of other things. Chris Ayendi Sanders, one of our clinical adjuncts. Suzanne Kleeman, Professor Suzanne Kleeman, who's acute care, medical, surgical. We have Linda Alston, another one of our clinical adjuncts. We have a new instructor, Professor Althea Michel, who will be joining us as our psych mental health instructor. A friend of the program, Ruth Amador, who's the president of the National Association of Hispanic Nurses. Professor Maura O'Shea, who does a little bit of everything. Professor Mary Tarbell, who among other things is our RN to BSN coordinator and also introduction professor. Professor Donna Polverini. Samantha Graglia, who we all started out with in the Center for Academic Success. Rose Andrazik from our Counseling Center. Aisha Ali, Professor Aisha Ali, who's one of our clinical adjuncts, Diane Fragamini, who helped you all in maternity, and Professor Carolyn Zafransky. Thank you. So I just wanted to touch on what the pinning ceremony is, because many of your family members may not realize that this is an important time in a way of celebrating this accomplishment of completing your baccalaureate program and your transition to professional practice. Many of you may not know that this tradition of receiving a nursing pin actually originated in the 1860s at the Nightingale School of Nursing with that Nightingale. At the St. Thomas Hospital in London. She began that tradition to extend an honor to her most outstanding graduate students by presenting them with a medal. The faculty at AIC believes in this tradition and that it's a very meaningful, important rite of passage. The nursing pin is both a literal and symbolic medal of honor and a badge of courage. It is nurses who remain with the patient long after everyone has gone home or given up hope. We are there at birth and we are there at death, and for every moment in between. Nurses never forget about their patients, even when we're not caring for them physically. They remain in our thoughts. Remembering always that we are caring for someone's mother, father, sister, brother, son, or daughter. The nursing pin that you're about to receive was designed in 1987 by a world-renowned artist, Alvin Page, who was the artist in resident here at AIC for many, many years. He created this pin with the fusion of different elements symbolizing the ideals of the college, the vision of the nurse, and his ideas as they related to nonviolence, peace, justice, and humanity. The pin bears the name of the college and the college's motto, which is post tenebris lux, which means darkness, after darkness, light. It symbolizes the entrance of the student into a bright new world through education. The nursing pin represents the division of nursing and its mission to provide high-quality education without regard to gender, race, ethnicity, or religion. And there are 3 letters, AIC, with the I being on top, representing interdiversity, interracial, and international college community that we have here at AIC. So as you receive your pin today, remember to always wear it with pride. Before we proceed in the program, I'd like to recognize a few students, and if they would come up, stand when I call their names. The first is Maria Mikalnicek. We had an academic awards ceremony here a couple of weeks ago, and Maria was the recipient of the Lillian Solomon Award in honor of the program's original director of nursing for her outstanding accomplishments across the curriculum at AIC. So congratulations, Maria. I would like to ask Gamden Al-Jermazi to stand. Gamden was the recipient of the Spirit of Nursing Award in recognition of his demonstration of cultural awareness and sensitivity over his entire experience here as a student. He always makes his patients feel respected and welcome and at ease, and his clinical instructor in his final rotation described him in a nutshell as truly representing the spirit of nursing. We had 2 recipients for the Nursing Leadership Award, April Saponsnik and Riley Lashat. Rachel also was found to demonstrate leadership in the clinical setting, but also here on campus as a peer tutor, always going above and beyond to help students. She has a way of going to help a struggling student, never looking for accolades, just helping them to be successful. And she's described by the faculty as having a peaceful presence around her that really helps students as they're anxious and preparing for exams. So thank you, April. And Riley, in addition to demonstrating leadership here in the clinical setting, she also shows a lot of community leadership, working very actively on a local task force supporting teen moms. And she's done this, giving generously of her time and talent across the years here. So this task force helps to aim for a Holyoke that has a well-rounded education for youth and helps expose these teens to be aware that there is a goal for them in education and a place for them to continue on. So thank you, Riley. I'd also like to recognize Shelley Perry. Shelley provided service to our country as a Marine, and she was recognized here on this campus with the Admiral John F. Hines Ribbon. John F. Hines was the 10th president of the AIC and a World War II veteran, and she was recognized for her service to our country with this award. At this time, I'd like to introduce Professor Ellen Furman, who is the class speaker.
Good morning, class of 2016. Vice President Parak, Dean Thompson, Director Russo, fellow faculty, family, invited guests. Today we're here to celebrate. I want to thank the senior class for asking me to speak at today's pinning ceremony. And it wasn't until I was preparing for this engagement that I started to realize it was somewhat apropos that I'd be asked to speak this year, because this is my 40th anniversary from graduating from nursing school. Thank you. It absolutely is a reason to celebrate, because along with age comes wisdom. Not so much beauty, age and wisdom. As I prepared, I thought about what I would like to share with all of you. With each student, had I been given the opportunity, the time, to sit and meet with you face-to-face, one-on-one. And so while I teach at the undergraduate level, my main responsibilities are at the graduate level. And within the Graduate School of Nursing, we have something called the 3 Ps. Okay? These are required courses that have to be taken in all graduate programs across the country. And those 3 Ps are advanced concepts of pathophysiology, advanced concepts of pharmacology, and advanced concepts of physical health assessment. And so I've taken somewhat of a literary license today, and I've designed the 3 Ps required of baccalaureate nursing here at AIC. The first required P, and now I did not talk to Director Russo prior, but the first required P is perseverance. So while many of you faced major life stresses, things like births, deaths, marriages, divorces, financial hardship, failure, transportation issues, childcare issues, and sometimes more than one of these events simultaneously, and sometimes more than one of these events consecutively. Today you can say that you persevered. On a lighter note, as sophomores in pharmacology class, because as I looked back I realized that I had you at each level. So as sophomores in pharmacology class, you learned all those prototype generic drugs and their rationale for use, struggling to say their names like furosemide, warfarin, omeprazole, atorvastatin, when you could have said the more familiar names, had you been allowed, like Lasix, Coumadin, Prilosec, or Lipitor, and it would have been a lot easier. As juniors in nursing class, you learn that seemingly foreign language of research. Yes, it was foreign. You learn the difference between quality improvement articles and research articles, primary versus secondary sources, qualitative versus quantitative methods. And you wondered if really rejecting the null hypothesis or failing to reject the null hypothesis was good or bad. Despite much frustration, you conquered a search of the literature for those perfect articles that included all your inclusion criteria. But perhaps the most challenging of all in nursing research is as you entered the realm of scientific writing, you began to use APA formatting. Now, note I said you began to use, not mastered. As seniors in leadership class, I had the opportunity, Professor McKinnon allowed me the opportunity to come in and talk to you about quality improvement. So you were able to decipher the alphabet soup that you've learned in quality improvement, or QI, when you developed a PICO, established an RCA, using the 5 Ys in order to implement your PDSA. And that was no easy FEAT. So today we celebrate your perseverance. The second P is potential. When it may have seemed like assignments were unreasonable, exam questions were ambiguous. Remember test review? Faculty were inflexible, or as we faculty often hear, they're trying to weed us out. Or personally, as I experienced, she really trashed my project. This truly dedicated nursing faculty were actually helping you to realize your full potential. Today we celebrate your achievement. The third and most profound P, at least in my opinion, is privilege. What I can say now, having been a registered nurse for many years, is that what you give to your patients and their families gives back to you 100-fold. And I don't say that lightly. Whether showing new parents their newborn for the first time, distracting a toddler before an injection, or holding the hand of an older adult who might have otherwise died alone. Being a nurse is a privilege. Today we celebrate that you, as a graduate nurse, too are privileged. So before I bid you farewell, I've had an added requirement, post-baccalaureate required P, and that's called prosperity. So as you continue to grow as a nurse, whether you practice near or far, please continue to keep in touch to tell us all about all the wonderful things that you're doing, and I know you'll do wonderful things. Please continue to make a difference in your patients' lives. Please contribute to the profession and the discipline of nursing, and please continue to make AIC proud. And finally, I would like to leave you with the words of the poet Robert Frost, who said, "Home is the place where when you have to go there, they have to take you in. Realize you'll always be welcome and always have a home here at AIC." Thank you for meeting with me today. Let's celebrate. Good job.
On behalf of the AIC Nursing Class of 2016, we wanted to present our class picture.
It's beautiful. Thank you very much. Thank you very much on behalf of the faculty. We'll hang this in honor with all of the other classes in our hallway as the hallway gets longer and longer.
We also have flowers for Professor Furman and Professor Kleeman. So I wanted to take a second, well, the class wanted to take a second to recognize somebody who meant a lot to us. I might cry. It's just an emotional day. Anyways.
She's a little pregnant.
Yes, a lot. So it's somebody who works really hard for our nursing program. They're also, I know, the first face that I see when I get to school. That smile. I think he's our biggest cheerleader. So Louis, could you just come up? You can talk if you want.
Thank you so much, and I hope that everybody keeps on doing the good work that y'all been doing, and remember that being kind and love takes you very far, and being obedient and being patient and always being kind. And thank you very much.
Thank you, Louis. We also want to make sure that we say thank you to Moose, everybody's other favorite, Kevin Panetta.
And now we come to the part of the program we've all been waiting for, the presentation of pins. So I'd like to call to the stage faculty in order to assist with this process.
Ready? I have the best part. Gamden Algermozy. Ashley Anderson. Amy Angeletti. Judith Azuike. Shonda Barnett. Alyssa Barnish. Morgan Bean.
Samantha Bodwin. Carissa Beebe. Sarah Belton. Nicole Berthium. Adam Cameron. Sarah Colson. Jessica Crochetier Santiago. Lauren Culver. Carrie Davis. Karen Davis Huggin. Kayla Damaris. Karen Diaz. Lisa Dombeck. Patricia Donnelly. Shazani Leona Rose Douglas. Connor Ellis. Marina Elsier. Jill Fiorini. Benjamin Gonzalez. Alexa Grigley. Ariel Henry. Manly Wen. Lisa Johansson. Jennifer Kakowski. Catherine Kaharchik. Riley Latchik. Nicole Ledoux. Christina Manfredi. Emily Manley. Jenna Macionis. Aaron McDonald. Talia Messier. Mary Mimick. Maria Mikulinchik. Heather Miller. Anna Medelsky. Stephanie Morris. Noel Nguyen. Tanaya Pearson. Dolores Perez. Shelley Perry.
Love you, Shelley.
Michonne Phipps. Ina Redka. Clayton Richard. Ashley Rosso. Grant Sampson. Cynthia Sanchez. Nicole Santiago Maynard. April Sapoznik. Stacy Seguro. Bonnie Schallbetter. Rachel Smetana. Sinead Smith. Brianna Solik. Kara Tangway. Kiana Tart. Terica Thaxton. Reza Walker. Iriel Wilson. Andrea Zeider. The nursing class of 2016.
I invite everyone to take a picture now while they're all together. Everybody smile. This is a Kodak moment for the entire audience. So here you go. All right, we need one from the official photographer real quick. I would rather not. I'd like to just get the picture taken. Make sure your face can be seen from behind, ladies and gentlemen, up on the stage there. Okay. All right. If ever, on behalf of the nursing faculty at American International College, I want to congratulate all of you on your accomplishment today. We're so proud of you. Some of you are moving far away, and some are staying close by. Just remember, as Professor Furman said, AIC is your home, and we always welcome you back home to visit, to share with future students, and to continue on your journey. So make sure you stay in touch, because that really helps us see your accomplishment and like to see the growth in our profession because of what we do. I want everyone to remember, each of you to remember, that the profession of nursing is a great adventure. The people you will meet, the experiences you'll have along the way, it's unpredictable and amazing, fascinating, frustrating, heart-wrenching, and inspiring. I have to tell you, I've never regretted for a moment choosing to be a nurse. I love being a nurse every single day. I learn something new, and you're going to have a wonderful career in front of you. In closing, I want you all to know that we as a faculty are really proud to have been part of your journey, and we enjoy looking to see you moving on to professional nursing. I would just ask that people clear the aisle so that we can have an exit, and I'll invite everyone to join us in a reception out in the lobby once the graduates exit. Thank you all for your attendance.